Hi, this is Dr. Shakir. So today we will see how to manage parents in a pediatric dental practice. So in a pediatric dental setup, it's not just about how skillfully you manage the child. It is also important to manage the parents efficiently. So let's see how we should go ahead with parents who are walking into your clinic with their child. Rule number one, whenever a pediatric patient walks into your clinic, don't immediately see them as an income or revenue to your clinic. Because most of the time, especially if you're practicing in a rural area, the parents are very much skeptical about the dental treatment in kids. They may be apprehensive, they may be demanding. All in all, more than you manage the child, they need to get settled down. You need to settle them down first. So it's always better to keep the very first appointment only for diagnosis and explaining the treatment plan to the parents unless there is an emergency. Now, rule number two, always explain about the complete procedure in the first visit itself. Let's say you wanted to do a pulpectomy. There is a deep dental caries, there is pain, so you decided to do pulpectomy. You confirmed with the x-ray. Now, explain them in how many sittings you are going to finish this treatment. Also, explain them about the stainless steel crown or whatever the crown you are giving in the very first visit itself. Because if you think, I will do the pulpectomy, I will finish off the pulpectomy first, then I will explain about the crown. No, that may backfire, because at the end of the pulpectomy, they may be expecting, the parents may be expecting that, okay, the treatment is over. Now at that point, if you say you have to go for a crown now, they will question you. Because how are you going to convince for a crown? You will say the semen may not last longer, so there will be a chance of pulpectomy failure, so you have to undergo a crown. If you are saying this after finishing the pulpectomy, they will definitely doubt you. The very first question that they're going to ask you is why you did not inform this earlier. If we had to spend more money on top of this, we wouldn't be ready for this. So in order to avoid this, you should always explain about the complete procedure in the very first visit itself. Now, that part itself is going to take us to the next point, that is point number 3. Always explain about the treatment cost in the very first visit itself. Because again, patients used to have a tendency to think that a children's treatment will anyway cost lesser than an adult treatment. So they will have an idea that how much it will cost for an adult root canal, and if your pulpectomy charge is somewhat near to that, so they will definitely question you. If you do pulpectomy, if you think like you will do pulpectomy first and later on you will explain about the financial aspect, no, that won't work out that way. They will definitely say, I didn't expect this much. Like, you did a filling for my son, I thought it will be lesser than the adult filling. You did a root canal on my son, I thought it will be lesser than the adult root canal cost. So always explain about the prices of the treatment in the very first visit itself again. Now coming to the last point, the point number 4. Even after explaining everything in detail, they still wanted to go for a second opinion. Be ready to hear that and accept it. So let them go ahead with that. But you may think, if we go by this way, we may lose the patients. But always remember, if you force the parents to take up the treatment then and there itself, and suddenly the child starts to throw the temper tantrums or the child starts to cry, it is the parents who should support you. If they are not convinced with what you have explained, or even for a simple reason that they wanted to take a second opinion which you denied, so in that instance, they won't be supporting you. In turn, you won't be able to complete the treatment. So to conclude, always remember that by the time you bring the patient, the child patient, to the dental chair, it should be in such a way that the parents wanted the treatment to get it done from you. It's not that you want them to take up the treatment. Because that's the only way you will have peace of mind while dealing with the child patient.